Childhood trauma is a difficult topic to approach, as it often lays hidden beneath layers of personal experience, impacting an individual far beyond their adolescent years. Its effects are profound and far-reaching, notably leading some down the path of addiction. But how exactly does childhood trauma pave the way for such turbulent lifetimes? To understand this connection, we must first delve into what childhood trauma truly entails. Trauma can arise from a variety of experiences: abuse, neglect, or even the absence of emotional support. Children rely on a secure environment for healthy development. When this sense of safety is disrupted, it fundamentally alters their perception of the world. Behind the curtains of trauma is our brain, an incredibly complex organ that's significantly affected by these early disturbances. Trauma causes excessive stress hormones like cortisol to flood a child's brain. Over time, this disrupts normal brain development, particularly in areas responsible for emotional regulation and impulse control. Consequentially, when adulthood approaches, the individual may turn to external substances as a means of self-soothing, seeking escape from the inner turmoil long embedded within. Moreover, childhood trauma can distort one's sense of self-worth and belonging. Feelings of inadequacy and low self-esteem become commonplace, leaving a void often filled by substance misuse. Drugs and alcohol offer temporary relief, a misguided but powerful attempt to reclaim control over one's emotions and reality. These substances may become a means to forget, to numb the pain that has never been addressed, or to fit into social circles that promise validation yet lead down dangerous paths. Insightful studies have highlighted the correlation between trauma and addiction. The Adverse Childhood Experiences, or ACEs study, discovered that individuals who endured multiple types of childhood trauma had a significantly higher risk of developing substance use disorders. This study illuminates how layers of untreated emotional pain lay the groundwork for addiction, showing a direct escalation in vulnerability with increased exposure to traumatic events. Social factors also play a pivotal role. Children who experience trauma often lack a supportive network. Without role models or mentors to guide them through turbulent times, they may find themselves gravitating towards negative peer groups, embracing harmful behaviors and substances to gain a false sense of acceptance. In essence, the absence of positive relationships can steer one closer to addiction, as they attempt to fill an emotional vacuum through destructive means. However, it's crucial to reinforce that trauma-induced addiction isn't a life sentence. Many find hope and recovery through therapeutic interventions. Programs and counseling that focus on trauma-informed care can break the cycle, helping individuals to process their past and rebuild their identity. In conclusion, the journey from childhood trauma to addiction is a complex interplay of neurobiological, psychological, and social factors. Understanding this intricate relationship is vital for breaking the cycle and providing effective support. By addressing the root causes and creating environments where healing can occur, society can offer a lifeline to those drifting in the turbulent waters of addiction. This path to recovery is difficult but ultimately transformative, providing a chance for individuals to rewrite their life stories with hope and resilience.